Hi, this is Dr. Gregory Robron, and welcome to my Bone Health and Wellness newsletter. Today's topic is, what causes a hip fracture? So I got an email from one of our new clients concerned about hip fractures, and she has a family history on both sides. Both her mother and father suffered from them, and she has concerns because, well, she saw them struggle after their injuries, and she had some questions about prevention. So hip fractures, they are a significant cause of morbidity and mortality, particularly in older adults. The incidence of hip fractures increases as we age and is more common in women than in men. Hip fractures result in considerable pain, disability, and decreased quality of life, and they are a leading cause of institutionalization in older adults. So in this newsletter, we will discuss two types of hip fractures, their causes, risk factors, and prevention strategies. Please note that the information presented in this video is not intended to diagnose any medical condition or offer medical advice. The purpose of this video is to provide viewers with information that can help them make informed decisions and have informed discussions with their healthcare providers, family members, and loved ones. So let's go ahead and get to the letter. Dear Dr. Greg, I am writing you today because I have recently been diagnosed with osteopenia and I'm concerned about my risk of hip fracture. Both my parents suffered from hip fractures in their later years, and I'm determined to do everything I can to avoid the same fate. My dad exercised all the time. He was very active, but my mother not so much. She had osteoporosis and had to have a hip replacement, and Dad had pins and wire surgery to fix his bone. Both of them struggled a bit after their surgeries, my mom more so than my dad. I am 58 years old, and I have always tried to take care of my health, but I realize I may not have been doing enough to prevent bone loss. I am now eager to learn more about what the causes are and what I can do to prevent hip fractures and protect my bones as I age. I am concerned about some of the drug therapies, and I have been hesitant in starting any of them, and I would appreciate any information that you can provide on ways to prevent hip fractures with someone with osteopenia. What changes can I make to help strengthen my bones? I am eager to take an active role in my own health, and I am committed to make the necessary changes to protect myself from a hip fracture. I look forward to hearing from you soon, and thank you in advance for your guidance. Okay, well, let's go ahead and we'll get into that. So hip fractures do not involve the hip joint itself, but are fractures of the proximal femur, the closest part of our femur bone to our pelvis. It is roughly the top 1/5 of that long bone. Now about half of the hip fractures are trochanteric, and the other half are femoral neck fractures. These are regions in that top 1/5 area. In older women, the proportion of trochanteric fractures increases with age. But once age is taken into account, trochanteric fractures are more related to bone density, while femoral fractures are more related to mechanical factors. In other words, the risk of trochanteric fractures is higher in individuals with weaker bones, while the risk of femoral neck fractures is higher in individuals who experience a greater amount of force on their hip, which is a function of its mechanical properties and bone geometry. So when we look at fracture prevention, bone density medications are a common and important tool in preventing hip fractures, but they are not the only solution. In fact, focusing solely on bone density medications as the primary prevention strategy can lead to a false sense of security, and as I mentioned before, not all hip fractures are primarily related to bone density, and focusing solely on improving bone density may result in neglecting other important risk factors to prevent fractures. In addition, bone density medications come with their own set of potential risks and side effects, including gastrointestinal problems, bone pain, in some cases increased risk of other types of femur fractures. While bone density medications are important, they should not be the only focus when it comes to preventing hip fractures. In fact, activities that promote strengthening, the kind of strengthening activities that assist in remodeling bone, increasing motor output, and improving protective balance responses should be considered just as important, if not more so, than medications or medication solely. These activities include brief but intense regular exercise, neuromuscular training, physical therapy, and/or balance training. Now, the reason this is vital is because more than 95% of hip fractures are caused by falling. By improving strength and balance, older adults can reduce the risk of falls, thus the risk of fractures, and can maintain their independence and quality of life. In addition, intense and brief exercise can improve bone density and stimulate reorganization of bone to resist fracture. Now, in addition, focusing on these types of activities can have broader health benefits beyond just reducing the risk of hip fractures. Exercise and physical activity can have been shown to reduce the risk of chronic diseases such as heart disease, diabetes, and depression, as well as improve cognitive function. Hip fractures can have a significant impact on an individual's quality of life, including their ability to perform basic daily activities such as walking, dressing, and bathing. And the risk of complications such as blood clots is also higher among older adults with hip fractures. Furthermore, the recovery process can be lengthy and require a significant amount of physical therapy, rehabilitation, and resources. In addition, most hip fractures are treated surgically with pins, screws, or a hip replacement, and they carry similar secondary risks as the fracture itself. Surgical procedures are invasive, and they also have risks of complications including infections, blood clots, and often they increase the likelihood of another fall and possible injury. Balance is often worse post-surgically, and furthermore, the recovery process can be lengthy and require significant physical therapy and rehabilitation. Not only can hip fractures have a physical impact on individuals, but they can also have a significant psychological impact. The loss of independence and the loss of mobility associated with hip fractures can lead to situational depression and anxiety. And in our culture, people highly value their independence, and they fear and worry about the associated loss of independence when they're injured. This can be very stressful, and this stress can make the recovery process even more challenging. Moreover, it is estimated that 14% of deaths following a hip fracture in previously ambulatory women were caused or hastened by the fracture. The 1-year mortality following a hip fracture is 12 to 24%. Thus, hip fracture prevention should be taken seriously, and efforts should be made to reduce the incidence of hip fractures, especially in older adults who are at low risk, and a top priority, particularly for older adults who are moderate to high risk. This is not something that should be brushed aside. So, in summary, hip fractures are a serious health concern among older adults, with significant physical and psychological impact. While bone density medications are important in preventing hip fractures, focusing solely on them can lead to neglecting other important risk factors. Hip fractures don't occur just because someone's bone density is decreased, but they also occur due to mechanical stress, poor strength, and impaired protective balance responses. A single fall can result in a fracture. Exercises that promote bone remodeling and strengthening and programming that greatly improve protective balance responses are vital in preventing fracture. Hip fractures are also usually treated surgically, but they can require lengthy physical therapy, rehabilitation, and resources. Hip fractures can also have a significant impact on individuals' overall health and mortality. So if you have a question or a challenge and you'd like to get my help, please visit www.osteostrongfl.com. If you happen to be in the Southwest Florida area, I'd love to meet you. And if you happen to be out of our area or traveling around the country or around the world, you can visit www.osteostrong.me to find an OsteoStrong studio near you. So until next time, I'll see you then.